Stretch out your left hand right now. Look at it. Have you felt tingling in those fingers recently? A numbness that comes and goes. A heaviness in the arm that wasn't there before. A strange weakness in your grip when you pick up a cup. Most people say, it's the circulation. It's age. I slept on it wrong. But what if your hand was telling you something completely different? Something about your heart? I'm Dr. Nova Blake, and I've been practicing medicine for over 30 years. Today I'm going to show you 7 signals your hands and arms send weeks, sometimes months before a heart attack. Signals you can observe right now. Signals most people misread or ignore entirely until it is too late. Stay until the end, because signal number 4 is the one that almost everyone who has survived a heart attack describes when they look back. And it is the one that almost nobody takes seriously in the moment. Before we begin, the essential disclaimer. This video is educational. None of these signals alone is a diagnosis. But each one is a reason for a conversation with your doctor. Not at your next routine physical in 3 months. Soon. Let me first explain why the hand is connected to the heart. Because understanding this mechanism changes everything. Why your hand speaks for your heart. Think of the heart as a pump that works 24 hours a day, 7 days a week, never stopping. This pump supplies the entire body with blood through a network of millions of blood vessels. When plaque builds up in the coronary arteries, the vessels that supply the heart itself, the channel narrows. Less blood gets through. The heart begins working under stress. And here is the critical point. The heart does not always send pain signals directly to where the problem is. The nerves that supply the heart travel along the same pathways as the nerves that supply the left arm, the left hand, the jaw, and the shoulder. The brain receives a pain signal and sometimes cannot pinpoint exactly where it originates. It interprets it as pain in the arm, in the hand, in the jaw. This is called referred pain. It is one of the most well-documented phenomena in cardiology and one of the most deadly, because it sends people in the wrong direction exactly when they need to go in the right one. But there is more. When the heart is under chronic stress, months before a possible event, the body begins communicating in subtler ways. Blood flow to the extremities changes. The autonomic nervous system responds. And these responses often show themselves first in the hands. The hands are the most sensitive barometers of the cardiovascular system. Because they are the farthest point from the heart, they register changes in blood flow first. Now the 7 signals. Signal number 7. Unexplained cold sweating without physical exertion. Picture this. You are sitting on the couch watching television, comfortable, relaxed, not doing anything. And suddenly you begin sweating. Not the normal sweating of a warm day or exercise, a cold, clammy sweat, sticky, the kind that makes your shirt cling to your skin. And you feel pale, dizzy, like something is wrong even though you cannot name what. This is your body releasing adrenaline because it knows the heart is in trouble. The sympathetic nervous system, the fight or flight system, activates when the heart is under acute stress. One of its responses is redirecting blood from the skin and periphery toward vital organs. The skin becomes cold and clammy as circulation to the surface drops. The sweat glands activate simultaneously. Cold, clammy sweating at rest, without a clear cause like fever or anxiety, is one of the classic warning signs of a cardiac event. The American Heart Association lists it as a primary symptom for a reason. If you experience this, especially combined with any other signal from this list, do not wait to see if it passes. Call 911. Signal number 6. Nausea and unexplained vomiting, especially in people with diabetes. Here is a piece of information that saves lives, and that almost no one outside of cardiology knows. Many people with diabetes do not feel chest pain during a heart attack. The neuropathy that diabetes causes over time affects the cardiac nerves. The pain signal from the heart simply does not get transmitted clearly. For many diabetic patients, the only warning they receive is waking in the middle of the night with intense nausea and vomiting. And the natural response is to think, something I ate, an upset stomach. And they take an antacid and go back to sleep. This mistake costs lives. If you have diabetes and you experience sudden intense nausea, especially if combined with cold sweating or any sense of discomfort in the chest, left arm or jaw, do not treat it as a digestive problem without first ruling out a cardiac cause. Go to the emergency room. Tell them you are diabetic and having these symptoms. Let them rule out a heart attack with an EKG and blood tests before you accept any other explanation. Signal number 5. Severe dizziness and unexpected weakness in the legs. You stand up from a chair and the room spins. Your legs feel like they might give out. You need to hold something to steady yourself. Women especially need to pay attention to this signal. Research consistently shows that women experience heart attacks with different symptoms than men. The classic crushing chest pain is less common in women. Dizziness, extreme fatigue, nausea and jaw pain are proportionally more frequent warning signs in women. These atypical presentations are one of the reasons women historically have worse outcomes from heart attacks, because they, and often their doctors, do not recognize them as cardiac warnings. Severe sudden dizziness without a clear positional explanation, especially in a woman over 60 with cardiovascular risk factors like hypertension, diabetes, or a family history of heart disease, is a signal that deserves cardiac evaluation. Signal number 4. Tingling and heaviness in the hand and arm. This is the signal I want you to understand most deeply. It is the one most commonly described in hindsight and most commonly dismissed in the moment. You are holding a cup of coffee or reading a book, and suddenly your left arm feels heavy. Not sore like a muscle pain, heavy, like lead, like it weighs twice what it should. And then a tingling begins. It moves down the inner side of the forearm. It settles in the pinky finger and the ring finger. That specific area, the inner forearm and the last 2 fingers. Here is the anatomy that makes this happen. The heart is innervated by fibers that enter the spinal cord at the levels of the 1st through 5th thoracic vertebrae. These exact same spinal levels supply the inner aspect of the left arm and the ulnar distribution of the hand, which corresponds to the pinky and ring fingers. When the heart is in distress, the pain signal travels to the spinal cord, and the brain cannot perfectly localize its origin. It projects the sensation outward along the same neural pathways into the arm and hand. This is why the tingling tends to be specifically in the inner arm and the pinky and ring fingers, not in the thumb or index finger. That specific distribution is one of the most reliable anatomical clues in cardiology. I want to tell you about one of my patients. I will call her Dorothy. She was 67 years old, a retired nurse from Charlotte, North Carolina. Ironically, She had spent decades teaching patients to recognize heart attack symptoms. She knew the textbook signs perfectly, and yet when it happened to her, she almost missed it. For 3 weeks, she had been feeling what she described as a strange heaviness in her left arm when she walked to her mailbox. It would come, last a few minutes, and disappear. She assumed it was a pinched nerve from her posture at her desk. She was embarrassed to call me about something so minor. It was not minor. Her stress test showed significant ischemia. A coronary angiogram revealed 2 major arteries with critical narrowing. She had bypass surgery within the week. 2 months later, Dorothy told me something I carry with me. I spent 35 years telling patients that the body always gives warnings. I just never thought I would be someone who needed to hear my own advice. I almost waited too long because I was embarrassed to make a fuss over what seemed like nothing. The tingling in the left hand is not nothing. It is the heart speaking through the only language it has available. Signal number 3. Shortness of breath with minimal exertion. You walk to the mailbox and you need to stop to catch your breath. You make the bed and feel winded. You climb 1 flight of stairs and have to sit at the top. This is not fitness level. This is not being out of shape. When the heart cannot pump efficiently, blood backs up into the pulmonary circulation. Fluid accumulates in or around the lungs. The lungs cannot expand fully. Every breath takes more effort than it should. The key distinction: this shortness of breath is new. It appeared, or has been progressively worsening, over the past weeks or months. Things that were easy 6 months ago are now difficult. That change, that progressive worsening, is the signal. Shortness of breath with minimal exertion, of new onset or progressive worsening, in someone over 60 with any cardiovascular risk factors, is a reason for a cardiac evaluation, not just reassurance. Signal number 2. Unexplained anxiety and a sense that something is wrong. This is the signal that is hardest to describe and most likely to be dismissed. People describe it as a sense of doom, a feeling of dread without a clear cause, an anxiety that is different from regular worry, something deeper, something physical, a sense that the body is sending an alarm that the mind cannot quite decode. The autonomic nervous system detects cardiac stress before the conscious mind can articulate it. The body knows something is wrong. It activates the threat response. The result is this inexplicable anxiety, this sense that something terrible is about to happen. Many patients who have had heart attacks describe this prodromal anxiety in the days or hours before. It is real. It has a physiological basis, and it should never be dismissed as nervousness. If you experience a sudden unexplained anxiety of unusual quality, combined with any physical symptoms from this list, take it seriously. Signal number 1. Chest pressure that does not behave like other pain. I want to correct a dangerous myth before I describe this signal. Many people believe that if the chest pain is not dramatic, crushing and unmistakable, it is not a heart attack. They are waiting for the movie version, and while waiting for that version, they miss the real one. Cardiac chest pain is often described as pressure, heaviness, tightness, a weight in the center of the chest, like someone sitting on your sternum. It is not a sharp stabbing pain that changes with breathing or position. It is a deep, constant pressure. It lasts more than 5 minutes. It can radiate to the jaw, to the left shoulder, down the left arm into the hand, to the upper back between the shoulder blades, to the upper abdomen where people sometimes mistake it for heartburn. Here is the critical instruction, and I want you to remember this above everything else I have said today. If you have chest pressure lasting more than 5 minutes, call 911 immediately. Do not drive yourself to the hospital. Do not wait for someone to drive you. Do not finish what you are doing first. Call 911. Tell them chest pain or pressure. Tell them your age. Tell them if you have diabetes or high blood pressure. There is something called the golden hour. If you reach the hospital within the first hour of a heart attack, doctors can open the blocked artery and the heart muscle can be saved almost completely. Every minute past that first hour, more heart muscle dies permanently. The people who survive heart attacks intact almost always got to the hospital fast. The people with the worst outcomes almost always waited too long. Please do not be the person who waited. The habits that protect the heart. The single most powerful thing you can do for your heart if you smoke is to stop today. Research shows stopping smoking cuts your heart attack risk by nearly half within 1 year. If you have high blood pressure and you are not taking medication consistently, this is the most important thing to address right now. High blood pressure is silent damage happening to your heart every single beat. If you have diabetes and your blood sugar is not well controlled, every point above target is accelerating vascular damage throughout your body, including your coronary arteries. Sleep 7 to 8 hours. The heart repairs itself during deep sleep. Chronic sleep deprivation is a major cardiovascular risk factor that is still dramatically under-recognized. Walk 30 minutes daily. Not running, not a gym. Walking. The evidence for walking as cardiovascular protection is overwhelming and consistent. And eat more food that comes from the ground and less food that comes from a factory. I want to close with something Dorothy said when she came back to see me 2 months after her surgery. She said, "I spent 35 years telling patients the body always gives warnings. I just never thought I would almost miss my own. Your body gives warnings. The hand that tingles, the arm that feels heavy, the shortness of breath on the walk to the mailbox, the anxiety that arrived for no reason. These are not nothing. These are the language of the heart. Now you know how to listen. Write hand in the comments if this video showed you something you did not know before. I read everything. If this video could save a life in your family, share it now. With a parent who has mentioned arm tingling. With a friend who has diabetes and has been having upset stomach episodes at night. One share can make the difference that matters. And if you have not subscribed yet, please do that now and turn on notifications. Take care of yourself. I'll see you in the next one.